You know, back in the day, if you needed a doctor or medical advice, you just pick up the phone. But these days, reaching out is just a Facebook message away. Here to talk about the rise of social media and medicine is Dr. Kerr with Synergy Plastic Surgery. But first off, a big congratulations is in order. You were named Texas Monthly's top doctor of 2014.
Yeah, there are definitely a few of us in that list, and we won the year before as well, and so very happy to get that award again this year.
For sure. And you're telling me you're becoming increasingly popular on Facebook.
Yeah, I mean, I think that Austin is a very tech-savvy town. We have a lot of folks here that are using that sort of technology. We see, you know, sort of the launching of Twitter and Foursquare out of South by Southwest, and I think that people love it. I mean, we have over 1,000 people that follow us on our business page, and it's clearly a huge way to sort of interact with our business, and really changes, I think, the relationship that the patients have with me and our practice.
So you guys launched your Facebook page about 4 years ago. So
yeah.
You were on the bandwagon pretty early. What are the benefits that you see coming from it, and what are the different ways that patients use it, and you use it to interact with them?
Yeah, I think that, you know, we use it to give them updates, to tell them about things that are changing, you know, not only in our practice, I mean, simple things, just hiring like a new employee or something like that, but also, you know, new procedures. The patients use it, I think, to interact also with like one another. So, you know, once they post a comment, you know, we may sort of broach a topic, they'll post a comment, other patients will post back to them, and so they'll sort of interact with each other as well as with me and our practice in general. So I think it's a really interesting way for us to get information out, and then patients also to learn information and to really, I think, utilize their doctor-patient relationship in a way that's really never been seen before.
And of course, when you start talking about social media and medicine, there's always the privacy issue. How does that work? If someone goes on and posts something, they're kind of allowing their name to be out there with that comment.
Yeah, I would agree. It's definitely a little bit of a sticky situation. I think that, you know, clearly the people that are out making those comments are okay with it, right? And I think that if you do have privacy concerns, then you're clearly not going to be participating in that sort of level. But I mean, I think that that's something that's going to definitely be developing over the years, and we'll have to see how that plays out, as far as, you know, you're clearly identifying yourself as a patient of ours by.
And you were talking about the power of social media, that some of your patients have never even met you, never stepped foot in your office, and they're calling up and booking appointments based off of things they have seen online.
Yeah, so I think that sort of the rise of online reviews, primarily through Google and Health Grades and other sort of organizations, have really sort of given patients an opportunity to kind of review almost, I mean, I hate to say it like a restaurant or sort of a hotel, but a very similar sort of experience. I mean, I actually have people that, you know, I looked last night on my way in here, we have about 300 or so online reviews that I could find in about 5 minutes. And so, you know, people read through all of them, and they're like, you know, he's the guy for me, just based on other people's experience, you know, before we've even met, which is, I mean, clearly something that never happened, you know, 5 years ago, and I think that that's something that we'll see increasing in the future.
Yeah, for sure, and free advertising. We are out of time. Surprise, surprise. We're going to put this interview online. You can post it on your Facebook page.
Yeah, we'll do it.